So you were started on an antipsychotic medication, but you've read all about how they lead to weight gain and you're not sure whether or not you want to keep taking it. Well, today we're going to discuss the 3 most effective medications used to combat antipsychotic induced weight gain. And at the end of this video, I'll throw in a bonus medication and talk about the first ever FDA approved medication specifically designed to target this issue. So if you're ready to take control of your weight and your health, make sure to stick around. Alright, as you already know, antipsychotics cause weight gain. Some medications are thought to cause less than others, but when it comes down to it, I've heard patients complain of weight gain on all of them. And what you'll see clinically is that some providers will have you hop from one medication to another, constantly switching in hope that the new one will be less problematic. But the biggest thing to know is that this is not always necessary, especially if you're someone who's finally found the right medication that has gotten your symptoms under control. The other option to consider is to add on a helper medication, so one that will reduce the weight and metabolic concerns. Now, I'm not a big fan of using one medication to treat the side effects of another, because that can take us down an ugly rabbit hole. But when it comes to weight gain on antipsychotics, I do believe it's necessary for a good number of patients because of how damaging these side effects can be on your overall health. So the first medication that I want you to know about is metformin. This is hands down the best studied treatment when it comes to antipsychotics and weight gain. As you probably already know, metformin is primarily used to treat type 2 diabetes, and it helps reduce weight by lowering insulin resistance in the liver and muscles. It reduces glucose production and absorption, and it can curb your appetite. Now, how effective is metformin? According to a meta-analysis published in Lancet Psychiatry, which included 12 studies and 743 adult patients, those who were on metformin, in addition to their antipsychotic, had a 3.27 kilogram or 7.2 weight loss. In addition, when compared to placebo, those who were on metformin also had a significant reduction in BMI and insulin resistance index. Let's now jump over to metformin use in kids. The largest study that has been conducted looking at metformin and antipsychotics is the IMPACT study. This was a 24-week trial that included kids ages 8 to 19 years old. And it found that those on metformin had a 0.4 pound weight loss, while those on placebo had an 8.5 pound weight gain. Not only that, there was also a significant reduction in BMI for those on metformin, whereas those on placebo had an increase in BMI. And then another bonus on top of these findings is that those who were on metformin also had improvements in areas such as aggression, hostility, anger, irritability, and impulsiveness. Kind of interesting. So let's talk about dosing real quick. In adults, I usually start at 500 milligrams twice daily, and the range is quite variable. And I've seen patients on anywhere from 750 milligrams all the way up to 2,500 milligrams per day, typically in divided doses. In kids, we dose things a little differently, and it's dependent on their weight. I'm not going to go into the exact details of this chart, but essentially what we do is we start low and go slow until we reach an effective dose so that side effects are minimized. And if you want a copy of this dosing chart, along with the information about all the other medications discussed in this video, I created a PDF for you that sums all of this up. The link to download it is in the description below. Now, what are the side effects to look out for? The most common ones are usually GI related, so decreased appetite and abdominal pain, nausea, vomiting, diarrhea. It's worth noting that this medication is not used in those with severe kidney disease who have a GFR less than 30, and those with metabolic acidosis. So overall, metformin is a medication that has shown promising results in managing weight gain and metabolic issues caused by antipsychotics. Those on it generally see less weight gain, improved lipid metabolism, and reduced insulin resistance while on it. And the added benefit is that it's cheap, okay? GoodRx has it for under $4 per month. Now for medication number 2, topiramate. After metformin, this is the next most commonly used medication to help with weight gain from antipsychotics. It was initially intended to treat seizures or migraines, but it's also used as a mood stabilizer in the psych world, and it's been shown to help with things such as PTSD, OCD, bulimia, and substance use disorders. However, it's thought to help with weight loss by improving insulin sensitivity. So how effective is it? The Journal of Clinical Psychopharmacology published a study showing that those on topiramate had a 2.83 kilogram or a 6.2 weight loss compared to those on placebo, essentially meaning that this medication can prevent or reduce weight gain associated with antipsychotics. In kids, the main study I found looked at 11 to 17-year-olds, and found that those on topiramate had an average weight loss of 2.62 kilograms or 5.8 pounds. When dosing topiramate, I will start adults on 25 milligrams twice daily and increase by 50 milligrams per week. In kids, I'll start a little lower and do around 25 milligrams daily, and then increase each week in 25 milligram increments. I typically try to get to a range of 150 to 200 milligrams daily. Adults can technically get all the way up to 400 milligrams daily, but the evidence for increased efficacy at these higher doses is relatively mixed. And generally, what we see is more side effects with the higher doses. The most common side effects that I see from this medication are decreased sweating or overheating during exercise. Other less common ones would be word-finding problems and cognitive impairment. Topiramate's brand name is Topamax, and in medical school, we would remember these side effects by calling it Dopamax, meaning that the medication can dope some people up. And then the other things to be aware of are the potential for metabolic acidosis, kidney stones, paresthesias, and visual field changes. Like metformin, the nice thing about this medication is that it's relatively affordable, with GoodRx showing a month's supply for under $5. Now, the third type of medication to know about are the glucagon-like peptide 1 receptor agonists, or the GLP-1s. These medications have been shown to do all sorts of things. They can decrease appetite, delay gastric emptying, which leads to us feeling full quicker, and increase the breakdown of body fat. And this is a class of medications that a bunch of celebrities are apparently taking. The main med in this group used in psychiatry is liraglutide, and its brand names are Victoza and Saxenda. And it's approved in these 10 and up for type 2 diabetes and 12 and older for weight management. Let's look at how effective this medication is. In a 16-week study, adult patients who were on an antipsychotic and liraglutide had an average weight loss of 11.7 pounds compared to placebo. In addition to this, they also noticed improvements in glucose tolerance, blood pressure, cholesterol, and visceral fat. Another 6-month study of 790 overweight or obese patients on antipsychotics had an average 13.2 weight reduction with the medication compared to placebo. A1C scores were also reduced. This medication is dosed differently than the metformin and the topiramate that we talked about. The biggest thing that sets it apart is that it's a daily injection. The starter dose is 0.6 milligrams, and this is increased very slowly because of the risk of nausea. And providers will increase the dose in 0.6 milligram increments weekly, up to a max of 3 milligrams per day. The most commonly reported side effects are headaches, nausea, and diarrhea. It's important to know that this medication is contraindicated in those with a history of pancreatitis, medullary thyroid cancer, and multiple endocrine neoplasia type 2. It should also be used with caution in those with renal insufficiency, and it can increase the risk of gallbladder disease. The main issue with this medication is that it is expensive, and most insurance companies are not approving it. GoodRx has it listed for over $1,000 per month, and I personally have yet to prescribe this in anyone. Now, as you might have already noticed, metformin, topiramate, and the GLP-1 agonists were not initially created with psychiatry in mind. They were just found to be beneficial in the psych patients who happened to be on them. So let me introduce you to Lybalvi, the first ever FDA-approved medication specifically designed to target antipsychotics and weight loss. This medication is a combination of olanzapine and samidorphan. Olanzapine, which is also known as Zyprexa, right? We've done videos on this one before, is an antipsychotic medication that we love to hate in psychiatry. We love it because it's a big hitter medication that can be very effective in those who have severe mental health struggles. We hate it because it's one, if not the worst offenders when it comes to weight gain. Studies have shown that just after 6 weeks of treatment, patients will gain over 5 pounds, so almost a pound per week. And this truly can be life-changing in the worst ways. So why does this happen? Well, what we see is that antipsychotic medications can increase the rewarding effects of high-calorie foods by amplifying the effects of opioids in the brain, which then leads to weight gain. The opioid system is a natural system in our body that is responsible for regulating pain, pleasure, and reward. And when we eat foods that are high in sugar, your body releases opioids, and this creates a feeling of pleasure or reward. This then encourages us to eat more of these types of foods, which then leads to overeating and weight gain. So where does samidorphan come into play? This medication blocks those opioid receptors, resulting in reduced pleasurable effects from your food. This then leads to less overeating and weight loss for patients. So how effective is this medication? Scientific Reports put out a meta-analysis that included over 1,000 patients who were either on the olanzapine-samidorphan combo or just olanzapine alone. In 3 out of the 4 studies, those who were in the olanzapine and samidorphan combo group had significantly better results when it came to mitigating weight gain. And this was especially true in those with a lower BMI. While it was helpful in reducing some weight gain, it was not protective against elevations in glucose or lipids. So when it comes down to it, the verdict is still somewhat mixed on this medication. Outside of it costing a ton of money, most studies only enrolled non-obese patients. So we really don't know yet if it will reverse weight gain in those who have already gained weight from being on antipsychotics. I have yet to prescribe this medication, but I'll be on the lookout for new studies supporting its use, and I'll let you know along the way what I find. Now, don't forget to subscribe if you found this information valuable, and click that next video to learn more.